ear infections, fevers, the flu. If you're experiencing an alarming increase in infections, investigate the effectiveness of your immune system. Dr. Akhilesh Chokshi is here to direct us in determining when there are deficiencies in our immunity. Dr. Chokshi is the director of the Allergy and Immunology Clinic at Metro Health. Thanks for joining us, Doctor.
Sure.
So tell us about our immune system.
Yeah, the basic, the job of the immune system is to protect you from getting sick. So as you mentioned, if somebody is getting sick, and if you really are sick of getting sick, that is the way to think about it. That maybe your immune system is not putting the right foot front ahead of it and then taking care of it.
So if you're getting, a lot of colds or fever or whatever, and it may not just be colds, it may be because of a problem with your immune system.
Absolutely. Again, I would say it's a very good analogy to think that if you get a cold in the summer, that's a bad problem. Mm-hmm. If you're getting cold all year round, something is wrong with it. If you're getting a lot of pneumonia, sinus infection, one antibiotic doesn't do the job, you need 2 or 3 or 4 courses to get over, it means something is lacking within you.
Are immune deficiencies rare?
That's a very good question. Everybody, including a lot of my physician colleagues, will think it's rare, but it is actually not rare as a group. It is very common. 1 in 10,000 people will have it, and some diseases are so common 1 in 500 will have it. So every practicing doctor will at least have 1 immunology patient or immune deficiency patient. It's not that rare.
Is this more common among older people?
It is common across all the ages. Traditionally, doctors will think that kids will have the problem, and in olden days when therapies are not available, people used not to be able to survive, but now I see across all ages.
All right, so let's say we're getting a lot of colds or a lot of little illnesses, but they keep coming. And you check it out and you find out that there's a problem with the immune system. Can these be treated?
Absolutely. The test is very simple to be done. Again, I would say URI and cold is okay, but if you got pneumonia, sinusitis, a lot of antibiotic is needed, that is worth. Any doctor can write, and I think it's worth for audience to remember, it's called immunoglobulin G. If they should run the immunoglobulin, that is the most important protein which fights the infection. And the test could be done, at least it's a good starting point.
It's a blood test?
It's a blood test.
And then what's the treatment?
The treatment is very effective. If you're missing this immunoglobulin, we can actually take from healthy donors and infuse the patient with it. And the patient have very productive, fertile, full life.
Is that a shot or is it a pill?
It's given 2 ways. It's given through IV access, through intravenous route, or at times we can give under the skin, like insulin shot. You get under the pump also. So 2 ways of delivering it.
So if someone's having uncommon colds or a number of illnesses like that, flus, etc., talk to their main physician, give somebody like you a call. Where do they go?
Yeah, I think they can talk to their doctor. They can also approach any allergy immunologist. I would reach out to the folks who are 50, 60 and up. Mm-hmm. Everything gets written down for getting old. Mm-hmm. A lot of these patients will have immune problem and they'll be missing. I have a lot of patients in 80s and 90s with this.
So a lot of times the doctors will just say you're getting old,
right,
when in fact they should be taking this blood test.
Yep, absolutely.
Thank you very much, Doctor.
Sure thing.
Appreciate it. If you're sick and tired of being sick and tired, as Dr. Chokshi said, take his advice and get your immunity evaluated. And to find out more, call Metro Health's Allergy and Immunology Clinic. The number is 216-778-2213, or go online to www.metrohealth.org/allergy clinic. My thanks to Dr. Chokshi for joining us today.
Find out more by calling Metro Health at 216-778-7800 or visit www.metrohealth.org. Want more Metro Health medical information? Be sure to tune in to WTAM 1100 Radio each Saturday morning at 7 for Metro Health and You, hosted by Dr. Christine Alexander. Next, charging ahead to get your medical records.